Hello, everyone. On behalf of the Senior Dental Care team, we want to welcome you to this webinar today. My name is Shelley Anthony. I am a dental hygienist with Senior Dental Care, and joining me is a fellow hygienist, also with Senior Dental Care, Jeannie Jandek. Over the last several weeks, Jeannie and I have been presenting webinars on various oral health topics. Today's webinar is a combined version of our weekly efforts.
In this webinar series, we will discuss how to assess a dental emergency. We will discuss the importance of good oral health and the correlation between oral health and systemic health. We will review basic oral care techniques for the caregiver, which will include caring for a resident's denture and partial. And we will also review common oral health conditions that you may encounter with your residents.
We hope you enjoyed today's webinar. Thanks for watching.
Let's start by talking through how to assess a dental emergency. Gathering some specific information from the resident will be beneficial for the dentist to make an informed decision on how to best help the resident. If a resident states that they have tooth pain, here are some questions that you can ask the resident to help narrow down the problem. Ask them where the pain is located. Ask them if they can pinpoint an exact tooth where the pain is coming from. Is it on the right side of the mouth or the left side? Is it an upper tooth or a lower tooth? What type of pain are they experiencing? Ask the resident if the pain is sharp, if it's achy, or if it's throbbing. And sometimes if they don't understand the word throbbing, you can tell them it feels like a heartbeat in the tooth. Is the area sensitive to cold or to heat or to both? Does it hurt when they chew their food? Does it hurt when they're at rest? Is the pain keeping them up at night? It's also important to note whether pain medications were given, and if they were given, ask the resident if it helped the pain. Also inform the dentist of the type of pain medication given, how much, and how often. You may encounter a resident that has a dental emergency in the absence of pain as well. So let's go through some of the things you may see visually that may be cause for concern. When doing a visual assessment of the resident, check the outside of the resident's face for swelling. Here's an example of what facial swelling from a dental issue may look like. As you can see in the picture, this person's face is not symmetrical. The left side is rounder than the right. So this indicates that the patient does have some swelling. The lymph nodes in the neck can also swell if there's a dental infection, and oftentimes they swell on the same side as the infection is located. Take a look in the resident's mouth. Do you see any swelling or redness in the area of the pain? Here's a picture of healthy gum tissue versus unhealthy gum tissue. Healthy gum tissue is pink and firm, and unhealthy tissue will be red and puffy. Sometimes you can even see bleeding in the tissue or pus around the area of the tooth where the pain is located. If the resident can pinpoint an exact tooth that's painful, look to see if the tooth is cracked. Here's a few pictures of examples of cracked teeth. I also have another picture here of some swelling around a tooth. So if a patient says that a specific tooth is hurting them, check the gum tissue around the tooth to see if it is puffy or red or swollen. Do you see what looks like a pimple on the gum tissue, either above the tooth, if it's an upper tooth, or below the tooth, if it's a lower tooth? Is the pimple draining pus? Now, when you initially look at the pimple, you may not see anything going on with it, but when you touch the tissue around the pimple, pus may express from the pimple itself. The pimple is called a fistula. So here's a few pictures of fistulas. I have a fistula around the front tooth. I have a couple fistulas on back teeth. The fistulas can be different sizes. They can be very tiny, and they can also be pretty large. And again, you may see pus coming out of them, you may not. But one of the best things to do is either take a gloved finger or even a Q-tip and press lightly next to the pimple and see if you see any pus coming out from it. People can also have a fistula and not have any pain with it. So just keep that in mind as well.
My goal with this webinar is to help you understand the importance of good oral health and make it clear that there is a correlation between oral health and one's overall health. By doing so, you'll understand how oral infections such as tooth decay and gum disease occur. Because the majority of our nursing home residents have compromised immune systems, I think it's really important for me to point out the most common systemic conditions that studies have shown to be linked to poor oral health. So let me just start by saying, in a nutshell, it's all about the bacteria. We have over 500 species of bacteria that thrive in our mouth at any given time. Some of them are good and some of them are bad. The good news is that our body's natural defenses and good oral health keep these bacteria under control. Also, our saliva helps to protect against disease-causing bacteria. The bad news is that poor oral health can result in very high levels of bacteria, leading to oral infections, such as tooth decay and gum disease. Now, it's important to note that the mouth is the entry point to our digestive and respiratory tract. Harmful bacteria that are in the plaque can enter the bloodstream through the gum tissue and cause health conditions in the body. Therefore, dental health and daily oral care are crucial for our residents' overall health. Just briefly, let me explain how the gum disease process works. We have plaque, and that's a soft, sticky, colorless film that adheres to our teeth. This is what we brush off every single day, and it is full of bacteria. Now, when that plaque is not removed regularly, sometimes even within a 24 to 48 period, that plaque turns hard. It's called calculus or tartar. Once that's hard, that provides a large sticky surface for more plaque to grow on. And this creates an environment for more bacteria. Again, like I said, we're unable to remove this once it turns hard. This hard tartar causes inflammation, swelling, bleeding, and a low-grade infection of the tissues that support our teeth. The longer that this tartar is on our teeth, it starts working its way down underneath the gum line. And when this happens, it starts destroying the bone and all the supporting structures that hold our teeth in place, ultimately can result in tooth loss. Gum disease is a chronic bacterial infection, and the more severe that this gum disease is, the greater risk to health conditions. That brings me to discuss some of the common conditions that are linked to poor oral health. The first one is endocarditis, and this is the infection of the inner lining of the heart chamber. This can occur when bacteria from other parts of our body, such as the mouth, spread through the bloodstream and attach to certain areas of the heart. Now, cardiac disease and stroke are two other common conditions. Again, the oral bacteria that are in our mouth can enter the bloodstream, attaching to the fatty plaques in heart's blood vessels, contributing to formation of clots. Studies and research also suggest that there is a direct link to the oral bacteria that causes inflammation and infection to cardiac disease and stroke. Research also suggests that patients with gum disease are 3 times likely to suffer from heart disease or stroke. The one disease that confirms to be significantly affected by poor oral health is diabetes. And this disease goes both ways. Patients who have gum disease increase their risk to develop diabetes. Gum disease hinders the ability for the body's ability to use insulin. Now, on the flip side, a diabetic patient, because they tend to suffer from dry mouth, that's a contributing factor to gum disease. And gum disease in diabetics also appear to be more frequent and severe. Now, the diabetic patient who also has gum disease find it more difficult to control their blood sugar levels. Studies also suggest there is an increased risk of premature death by 400 to 700%. The next common condition is pneumonia, and this is really prevalent in the nursing home facilities. Studies have shown that one of the most common respiratory bacteria in the mouth and plaque is pneumonia. And what happens is that overgrowth of bacteria in the mouth can be breathed into the lungs. And finally, the last condition, and more recent, is Alzheimer's disease. Alzheimer's disease, studies have confirmed that the bacteria that causes gum disease has been found in the brains of Alzheimer's patients, both living and deceased. And this continues to be an ongoing research. So consequently, I think we can all agree that these specific conditions are frequent among our residents. And as a result, dental health is directly related to the well-being of our residents. More importantly, daily oral care for our residents is an important aspect to the quality of their life because there is a correlation between chronic oral infections to one's overall health. Just remember, the mouth is the window to your body's health.
Keeping your residents' teeth and mouth tissue clean can reduce the incidence of cavities and oral infections, which in turn greatly affect your residents' overall health and well-being. Helping your residents to maintain good oral health can significantly decrease the incidence of common major health issues like pneumonia and MRSA. There is a psychological aspect to poor oral health as well, which can have a huge impact on your residents' overall emotional well-being. Research has shown a strong relationship between gum disease and many mental health issues like stress, depression, distress, anxiety, and loneliness. First, I would like to explain what plaque and calculus or tartar is and why it is so important to remove this debris from the mouth. Plaque is a soft, sticky substance that is produced by the bacteria in the mouth. Plaque sticks to the surfaces in the mouth like your teeth, gum tissue, and tongue. 1 cubic millimeter of plaque contains 100 million bacteria. Plaque causes bleeding, swollen gum tissue, and plaque causes destruction of teeth. The harmful bacteria in plaque can enter the bloodstream through the gum tissue and cause many health issues in the body. Plaque bacteria can also be breathed into the lungs and cause respiratory infections, pneumonia, and acute bronchitis. When plaque is not removed regularly by brushing and flossing, it can harden into calculus or tartar. Calculus or tartar is plaque that has mineralized and hardened. Calculus cannot be removed by brushing or flossing. A professional dental cleaning is needed to remove calculus. Even though you cannot remove calculus with a toothbrush, it's still very important to brush around the buildup daily to remove any newly formed soft plaque. Before I talk about how to clean a resident's mouth, I would like to give you some tips on how to best approach the resident to ease compliance and help you gain better access to the mouth tissue and teeth. When approaching the resident, try to be at eye level with the resident. If the resident is in a wheelchair, bend down to their level or sit in front of them in a chair. If they're in bed, raise the bed so that you're at eye level if possible. Bedridden residents should have their head elevated to prevent choking. Explain to the resident what you are about to do and show them the toothbrush so they understand. With dementia residents, this will help to minimize confusion. If you have a resident who is hard of hearing, lean close to their ear so they can hear you. Be gentle in your approach, move slowly, and touch gently. Always inspect the resident's mouth before brushing to assess for removable appliances such as partials and dentures, or abnormal findings such as sores, swollen tissue, cracked or loose teeth. A tongue depressor can be used if available to hold the cheeks back for better access. Any abnormal findings should be noted and a dental visit scheduled if needed. Partials and dentures should be removed before brushing. It is important to understand that the information I'm sharing with you today is intended for the caregiver. These techniques are meant to be simple yet effective. So let's talk about toothbrushing. The toothbrush should be clean with soft bristles and a small head. The bristles should be uniform and not frayed, as this could scratch the gum tissue. Use a pea-size amount of fluoridated toothpaste or just water. Try to work in sections at a time so as not to miss any areas. Work back to front, upper first then lower. Establish some kind of pattern if you can. Use a gentle circular motion and light pressure, concentrating on the gum line on both sides of the teeth, the cheek side and the tongue side. It's very important to remove debris from around the gum tissue. Have the resident close slightly to relax the cheek muscles for better access to the cheek surfaces. Gently brush the chewing surfaces and gently brush the top of the resident's tongue. A clean tongue will be pink in color. Plaque will be removed easily, however, calculus and tartar will not come off with a toothbrush. A professional cleaning is needed to remove calculus. Bleeding may occur if inflammation is present. However, with consistent daily brushing, you should see this bleeding and inflammation subside. Be aware that a resident may bite down on a toothbrush as well as your fingers. Keep your fingers away from biting surfaces of the teeth. If a resident bites down on the toothbrush, do not pull the brush. Just let up on the grip and gently ask the resident to open. Forcing the brush away will only cause the resident to bite harder. Have the resident rinse between sections if necessary, or an oral swab moistened with water can be used to wipe the teeth if the resident is unable to rinse. Rinse the toothbrush thoroughly after use and remove all excess toothpaste from the brush. Store the resident's toothbrush in an upright position in a cup or holder and allow it to air dry completely between uses. Do not store residents' toothbrushes together in the same cup or holder to prevent the spread of bacteria. Toothbrushes should be replaced every 3 months or after a contagious illness such as a cold or the flu. A resident that has inflamed gum tissue may not be able to tolerate brushing due to it being painful. Using an oral swab or a washcloth to remove plaque and food debris may be tolerable for the resident until the inflammation subsides. Dipping the swab in antibacterial mouth rinse such as Crest Pro Health or Listerine Zero can also be beneficial in helping to bring down the inflammation. Oral swabs can be used to wipe debris from teeth and oral tissues or to apply antibacterial mouth rinses. Oral swabs can be used to remove food debris from the vestibule of the resident's mouth as well. And the vestibule is the area where your cheek and lip tissue connects to the gum line. 2-minute brushing is recommended once in the morning and once before bed. However, if there is a resident who is more compliant at another time of the day, then brush their teeth at that time. Some residents are more compliant with certain caregivers than others, and if a resident is not cooperating with you, have another caregiver try. You may have a resident who will not cooperate at all one day, but they might be fine the next. It's important to keep trying. NPO residents that cannot have anything by mouth still build up bacterial plaque in their mouths. Brushing with a water-dampened toothbrush and no toothpaste or using a water-dampened oral swab is recommended. Food debris that's stuck between the teeth is not always removed during brushing. It is very important to use floss or use an interdental aid to remove food debris from between the teeth to prevent swelling, inflammation, and discomfort of the tissue in that area. Ideally, flossing should be done at least once a day, preferably before bedtime, and always when food debris is stuck between the teeth. The use of a floss handle or flossing stick is recommended as it is easier to access the back teeth and avoid being bitten. Begin flossing in the posterior area and work around to the other side in a pattern so as not to miss any areas. Move the floss up and down between the teeth, holding it against the tooth surface. Never floss in a sawing motion, as this can actually cut the gum tissue. Soft picks or proxa brushes can be used instead of floss to clean between the teeth. They're very easy to use, and you use them in and out just like a toothpick in an in and out motion. Bleeding may occur during flossing or cleaning between the teeth due to inflammation, but should get better with consistent daily cleaning of the area. Let's talk a little bit about oral rinses. Alcohol-free antibacterial oral rinses such as Listerine Zero or Crest Pro Health can be used to help inflammation heal. After brushing, have the resident rinse with about 2 ounces for 30 seconds, morning and evening. If the resident is unable to rinse, then swabbing the gum tissue and tongue using an oral swab dampened with the mouth rinse is sufficient. So let's review the recommended daily oral care regimen for a resident. Brush for 2 minutes, once in the morning and once in the evening. Remove food debris from in between the resident's teeth at least once a day, preferably before bed. And use an antibacterial mouth rinse after removing plaque and food debris morning and evening if needed. If a resident is uncooperative, do the best you can when you can. Some dental care is better than no dental care.
In today's webinar, I will help the caregiver understand the importance of good oral care as it relates to proper care of removable dentures and partials. I'm also going to be reviewing the care and storage of removable partials and dentures to aid in the prevention of oral and systemic health issues. So let's first define what a denture and a partial are. These are removable appliances that replace missing teeth. The denture replaces all of the teeth, and the partial replaces selected missing teeth. Now, these appliances, and I'll be using that term interchangeably, these appliances help to improve smile and speech. They also support facial muscles, and they also help to restore chewing function. But what I find most rewarding is that it increases the self-esteem for our residents. There are important facts to note for residents who have dentures and partials. Just like natural teeth, plaque and calculus or tartar can collect on and around these appliances. This creates oral infections, which ultimately can affect our overall health and well-being. Now, good oral health can significantly decrease health issues such as pneumonia and MRSA. Ironically, these are the 2 most common bacteria that are found on dentures. Denture care and removal reduces the incidence of oral infections and health conditions. By removing these appliances, we are allowing the tissue to breathe, rest, and receive beneficial exposure to antibacterial agents that are naturally present in saliva. Now, as I said before, just like with natural teeth, plaque and calculus can collect on and around these appliances. Plaque is a very soft, sticky substance film that clings to these appliances. It's full of bacteria, and that's what we brush off every single day. But when we are not removing this plaque quick enough within a 24 to 48-hour period, that plaque turns hard, and it's called calculus or tartar. This just gives a greater environment for more plaque and bacteria to grow. Now, once it is hard, we can't remove it with just normal daily hygiene practices or even denture products. That's where I come in. You need a professional dental cleaning. The two most common effects of poor oral care and non-removal of these appliances are stomatitis and angular colitis. Stomatitis is mouth inflammation, redness, and infected with yeast. And this typically occurs under the upper denture in the palate or roof of the mouth area. This can also appear underneath partials too. Now, angular colitis is a subsequent infection by the same yeast as stomatitis. And this appears as redness and cracking of the corners of the mouth. It can be really, really painful. I also want to mention that people who wear removable partial indentures experience a gradual process of bone resorption. This is a decrease in bone density and volume. These appliances put pressure on the gums and consequently the bony ridges beneath them. Therefore, by wearing these appliances for a prolonged period of time and not removing them regularly can only accelerate this process. Now, what happens with this is it presents a lack of retention and comfort for the denture wearer. A lot of challenges happen the more that this bone is resorbed. The information I'm sharing with you today is intended for the caregiver, and I would like to share with you some dental tips that are meant to be simple yet effective. Always approach the resident with compassion and patience. Be transparent. Tell the patient what you're going to do before you do it. You want to communicate very simple instructions, clear and concise. I have found this really helps to reduce any fear or anxiety that they may have. Now, if you have a tongue depressor available, that's really helpful to help retract the cheek for better access. And by all means, please do not force any dental care on a patient. If they're non-compliant, try a different time of day. Sometimes residents do better in the morning than they do in the afternoon. Sometimes they do better in the afternoon than they do in the morning. I've actually seen residents do better with one caregiver as opposed to another caregiver. So these are just some simple tricks to try. And finally, denture removal should be done gently by placing a gloved finger alongside of the denture and breaking the seal in between the denture and the mouth. Partial removal can be done by using the clasp of the partial by loosening and gently lifting out of the mouth. So let's talk about daily denture care and storage. You always want to place a towel in the sink or fill the sink up with water. And what this does is it prevents breaking the denture in case you drop it. You'll rinse the denture off to remove any loose food or debris, and then you'll take a gauze or a tissue and remove any adhesive that may be present on the denture or partial. Use a denture brush or a soft toothbrush to remove plaque and bacteria. Now, a denture brush, those bristles are specifically designed and arranged to fit in dentures. But if you don't have a denture brush, a soft toothbrush is just fine. Use hand soap, mild hand soap, or an over-the-counter denture cream or paste specifically designed for denture cleaning. Do not use toothpaste. It's too abrasive and it can cause microscopic scratches on these appliances. Always rinse your denture off before you replace it in the patient's mouth. When we store these appliances, we're going to store them in a denture bath or cup. We'll submerge them under fresh, cool water or a denture cleaning solution. This prevents drying out, losing shape, becoming stiff and uncomfortable for the patient to wear. The ideal time to soak these appliances are at bedtime. But if you have a resident that is reluctant and doesn't like to sleep without their dentures, you can do this during the day and soak them for about 4 or 6 hours during the day. You always want to store the container in a safe place away from an area where it can't fall off the counter and break. By storing these appliances correctly, it prolongs the life of the denture. So let's review the ideal daily recommended regimen for denture and partial care for the resident. Okay, so PM, bedtime. You're going to remove the denture. You're going to rinse it with water to remove any excess food or debris. You'll take a gauze or tissue and remove any adhesive. Then you will place it into the denture bath with a cleaning tablet. This will soak overnight. What this does is it reduces and kills the bacteria. In the morning, you'll come in, you'll remove this denture out of the denture bath, and you're ready to brush. You'll brush this denture or partial thoroughly using the mild soap or the over-the-counter denture cream. You'll rinse thoroughly before placing it in the patient's mouth. Go back to the denture bath and remove that water, clean it out, and clean the denture bath so it's ready for the next use. If a resident refuses to sleep without their denture or partial, just follow the same routine. Soak, then brush. Soak as long as you can during the day. This can be done while they're watching TV or taking an afternoon nap. 4 to 6 hours a day is recommended. Now, in addition to daily denture and partial care, it's key to maintain oral care of the mouth. And we're going to do this upon removal and placement of the appliances. You're going to use a soft toothbrush. You're going to brush the gums, the tongue, the cheek, and the roof of the mouth. This removes plaque and it stimulates circulation in the tissue. It also reduces oral irritation and bad breath. If you have a patient that has limited access or is challenging, you have a hard time getting access into the mouth, you can always use a washcloth or an oral swab. By dipping the oral swab into an antibacterial mouth rinse, this is also beneficial to plaque removal. Just always remember that dental health and daily oral care, to include removable dentures and partials, are crucial for our residents' overall health and an important aspect to the quality of their life.
In today's webinar, I will explain various oral health conditions that you may encounter with your residents, as well as the best way to deal with these issues. Oral health can have a profound effect on your residents' overall health, both physically and emotionally. For this reason, it's important to be aware of conditions that can affect your residents' oral health. I would like to start out by discussing a common oral condition that can cause daily discomfort for residents. This condition is called xerostomia or dry mouth. Dry mouth can be a side effect of a variety of medications. Residents receiving radiation therapy for cancer can also suffer from dry mouth. It is prevalent in residents with diabetes, as well as those who have autoimmune diseases like Sjogren's syndrome. Alzheimer's patients are more prone to dry mouth as they may not drink enough water because their body's signal for thirst is not as strong as it once was. Residents who sleep with their mouth open will often suffer from dry mouth, and dry room air can also worsen dry mouth. Dry mouth can cause mouth tissue to burn and be irritated. Dry mouth can make chewing and swallowing difficult, and it can also cause the tissue to stick to the teeth, which makes talking difficult. Let's talk about what saliva is and why it's important. Saliva is a tasteless, odorless fluid. It's slightly acidic and viscous, and it's secreted into the mouth by glands. Saliva is important because it keeps the mouth moist and comfortable. It aids in chewing and swallowing, as well as tasting of food. Saliva fights germs in the mouth, which helps prevent inflammation of oral tissues and gum disease. Saliva has proteins and minerals that protect tooth enamel and prevent tooth decay. Saliva can also help dentures stay in place. So what can you do to help your residents get some relief from dry mouth? Help your residents keep their teeth and mouths clean. Daily brushing of teeth and cleaning of removable appliances such as dentures and partials is very important. Make sure residents are drinking enough water. And place a vaporizer in their room to add moisture to the air, especially during winter months when the heat is on. Have them use mouth rinses and gels designed for dry mouth, such as Biotene. Let's review how to use Biotene for dry mouth. Biotene rinse may be used after brushing, both morning and evening, as well as any time of day for comfort. An oral swab dipped in Biotene can be used if a resident is unable to rinse. Biotene gel may be used as needed to lubricate oral tissue and is especially effective before bed to increase comfort while sleeping. Simply squirt about a teaspoon of the gel into the resident's mouth and have them move it around with their tongue. They can spit out any excess if needed, but don't let them rinse with water afterwards so you don't rinse the gel out of the mouth. An oral swab can be used to apply the gel as well if necessary. Consistent daily use of both Biotene rinse and gel is recommended for maximum effectiveness and comfort of the resident's oral tissue. Inflamed, swollen gum tissue is another oral condition that can cause discomfort and pain for a resident. Gum tissue inflammation can be caused by excessive plaque, calculus, and food debris around teeth and gum tissue. Swollen, inflamed gum tissue can also be caused by an infected tooth. It's important to note that if you see a raised pimple or mass-like swelling in the mouth, a dentist should be notified as soon as possible. What should you do if a resident presents with inflamed, swollen gum tissue? Clean the area with a toothbrush, oral swab, or washcloth to remove plaque and food debris. Clean between the teeth with floss or an interdental pick to ensure there is no food debris lodged between the teeth. Use an alcohol-free antibacterial mouth rinse such as Listerine Zero to irrigate the area. For swelling or inflammation that does not subside, or if the resident's face or lymph nodes are swollen, have the resident see a dentist as soon as possible for proper evaluation. Dentures and partials can often cause issues for residents as well. Denture stomatitis is an inflammation and redness of the oral tissue underneath a denture or partial. Often you can see the red outline of a resident's denture or partial on the tissue after removing it after removing the appliance if they have stomatitis. Oral candida, or a yeast infection of the mouth, is associated with denture stomatitis. Denture stomatitis can be present with or without white patches. There are a few things that can cause denture stomatitis: plaque on a denture or partial, not removing a denture or partial at bedtime to give the tissue air and rest, and poorly fitting our old dentures. Here's what you can do to prevent stomatitis. Clean the denture or partial daily by soaking at night with a denture cleaning tablet and brushing thoroughly to remove plaque and food debris. Make sure the denture or partial is taken out at bedtime to allow the resident's tissue to breathe and rest. Keep the oral tissues in the mouth clean of plaque and food debris. If the resident has stomatitis and it does not clear up on its own, an antifungal medication such as nystatin may be needed. Make sure a dental exam is scheduled as soon as possible. Another common issue for residents with dentures and partials is sore spots. These occur when the tissue under or around the denture or partial gets irritated from either food debris being trapped underneath the denture or the denture rubbing against the tissue. If a resident complains of a sore spot, remove the denture and rinse it under cool water to remove any food debris. Inspect the tissue for redness or irritation. Keeping the denture or partial out of the resident's mouth after meals to give the irritated area a chance to heal is recommended. If the tissue is only slightly irritated, a small amount of adhesive placed on the denture or partial in the area of irritation can be used to cushion the area during eating and prevent further irritation. However, do not apply adhesive if the tissue is blistered or bleeding. If the tissue is severely inflamed, torn, or bleeding, irrigate the tissue with warm water and keep the denture out as much as possible to help the area heal. If the area does not heal or wearing the denture continues to cause irritation, please have the resident see a dentist as soon as possible. An adjustment of the denture or partial may be necessary. Angular colitis is a condition that occurs when saliva pools in the creased tissue at the corners of the mouth, causing redness, irritation, and cracked tissue. Candida or yeast-type fungus can also grow in the area due to moisture from the saliva. Angular colitis can be bilateral or unilateral. It can extend onto the facial tissue, and it is often seen in denture wearers. What can be done to treat and prevent angular colitis? Vaseline or a protective ointment applied daily, especially before bed, can help prevent and treat mild angular colitis. If ointment does not help, an antifungal may be necessary. Consult a dentist or physician for the best treatment options. Candida or oral thrush causes white patches, usually on the tongue or inner cheeks, but these white patches can also occur on the roof of the mouth, the gum tissue, and the back of the throat. Oral thrush can cause loss of taste. In severe cases, redness, burning, or soreness may also occur. And this may make it difficult for the patients to eat or swallow. Oral thrush is common in people with compromised immune systems or in residents whose natural body flora has been altered by antibiotics. Evaluation by a dentist or physician is recommended for the best course of treatment. Dry, cracked lips can be very uncomfortable for residents, causing discomfort when eating and talking. Here are some things you can do to help heal and prevent dry, cracked lips. Keep the lips dry of saliva. Lubricate lips daily, especially before bed, and avoid products with menthol or camphor, as these can cause more dryness. And advise the resident to avoid picking at their lips. Let's discuss the difference between a cold sore and a canker sore. Cold sores can develop inside and outside of the mouth. Canker sores only develop inside the mouth. Cold sores are contagious. Canker sores are not contagious, and both can be painful. Cold sores appear as a single blister or cluster of blisters. Canker sores can appear as a single round sore with red edges and a light center. Cold sores can be treated with ointments, lip balms, and sunscreen. And antiviral medication can also help cold sores heal. Canker sores can be treated with ointments and mouth rinses. Both cold sores and canker sores usually go away on their own within 1 to 2 weeks. However, consulting with a dentist or physician is recommended if healing does not occur within a reasonable amount of time. Black, hairy tongue is caused by too much bacteria or yeast growth in the mouth. This can develop in residents with poor oral hygiene. It can also develop after antibiotic use, since antibiotics cause an imbalance of bacteria. Residents who are dehydrated and have dry mouth can also develop black hairy tongue. It is more prevalent in men, HIV patients, and intravenous drug users. Most of the time, black hairy tongue can be treated by improving oral hygiene conditions. Brushing the top of the tongue twice a day or using a tongue scraper is recommended. In severe cases, a dentist should be consulted for additional treatment options. Today I have shared with you examples of common conditions that your residents may present with. If you are unsure of the oral condition a resident has, or if you are unsure of the best course of treatment, please consult a dentist or physician as soon as possible.
In today's webinar, I will provide the caregiver with recommended dental aids and products to help better deliver oral care to the resident. I will also review the use of dental aids to assist the caregiver in providing oral care to the resident. Now, it's important to note that all dental products need to have the ADA seal of acceptance. This will ensure that these dental products have been evaluated for safety and effectiveness. So let's begin with toothbrushes. If you're using a manual toothbrush, you want to select a toothbrush with soft bristles and a small head. You also want to select a larger handle. This will provide an easier grip and better control. Now, if you are assisting a resident, again, want to use a larger handle, but these handles can be modified with a ball or a foam wrap. What this does is it increases the diameter of the handle to help for better comfort, grip, and control. Ideally, an electric brush is recommended just because it's easier for the caregiver. All you have to do is place and go. You don't have to manipulate or apply pressure. None of that is required. And all of these electric toothbrushes do have larger handles, which helps for better control and a more comfortable grip. There are two types of electric brushes. You have a battery operated or a higher end electric brush are your rechargeable base. Now, the electric toothbrushes with the rechargeable base typically will come with a 2-minute timer on them, which is extremely beneficial because that's what we recommend for the amount of time to brush. If access is a problem and you're unable to use a toothbrush, you can always use an oral swab or a washcloth. Oral swabs can be used to remove plaque and food debris out of the mouth. You can do this by dipping it in an antibacterial rinse or just plain water. Oral swabs can also be used to apply fluoride gels. And if you don't have an oral swab, again, you can use a washcloth. Next are floss aids. The first floss aid is a floss holder. Floss holders come with the longer handles, which make it easier to maneuver and control and grip. Now, the way a floss holder works is you take a specific amount of floss and thread it onto the floss holder. It's very easy to do. The second type is a pre-threaded disposable floss pick. These come in different sizes and different handle shapes. Both are really easy to use, and you utilize them by sliding the floss in between the teeth gently and rubbing it on each side of the tooth, removing that plaque. Ideally, when you take the floss pick or the floss holder out, you want to wipe that floss off or rinse it before you go into the next area. There are also interdental aids, Proxa brushes or interdental brushes. And these come in a variety of sizes and shapes. These brushes are ideal for when there's spaces between the teeth. depending on how large the space is going to determine what size of brushes that you're going to use. These brushes are applied in between the teeth in an in and out motion. Again, rinsing the brush off or wiping the brush off of plaque before you take it into the next area. Toothpicks are also really good to use. They're called Stimudents. Now, unlike a regular toothpick, your Stimudent has a blunt point, so it doesn't injure the tissue, which is fantastic to use. And this is a really common interdental aid because toothpicks are so easy to use and everybody's always used one. It's really important to remember that we must remove plaque and bacteria off of our tongue, and this is done with a tongue scraper. Tongue scrapers come with a very long, easy to control handle. They're used by starting at the back of the tongue and scraping forward. Again, you will rinse that scraper off or wipe it off before you go back in to scrape again. By using a tongue scraper, this is going to help reduce bad breath, since bacteria that is located on the back of the tongue is a contributing factor to bad breath. It also opens pores and leads to better exposure of taste buds, and this enhances our sense of taste. Now, all of these products that I have talked about can all be better utilized if we use a mouth prop. Mouth prop helps to keep the mouth open. They're made of foam, plastic, and you can even make one using a tongue depressor and gauze. You wrap the gauze at one end of the tongue depressor like a cushion, and this helps the caregiver with better access and greater safety and control. So let's talk about over-the-counter rinses. The first type of rinse are your antibacterial rinses. That's Listerine Zero or Crest Pro Health. Both are antibacterial, which reduces plaque and bacteria, and both of these are alcohol-free. You always want to use an alcohol-free rinse because that is a contributing factor to dry mouth. Dry mouth is a common condition with our residents. So, like I said, they're both antibacterial and alcohol-free. The next type of rinse are your fluoride rinses. That is ACT, A-C-T. It's a fluoride rinse. This rinse is also alcohol-free. It reduces sensitivity, and it also helps prevent cavities. Now, like I said before, a common condition with our residents is dry mouth, and this is contributed to a variety of medications. If patients are undergoing radiation therapy, or if they're diabetic, or if they have autoimmune disease, they suffer from dry mouth. And the number one recommended dry mouth rinse is Biotin. Biotin contains moisturizers and lubricants. It is also clinically proven to soothe and moisturize dry mouth for immediate and long-lasting relief. Biotin has a large product line to include paste, gel, rinse, spray, or even lozenges. Now, depending on which product you use, it's very important that you follow the manufacturer's instructions. Lastly, and probably most common, is our denture products. We'll start with a denture brush. A denture brush these bristles are specifically arranged and designed to fit into the denture. You also want to use a non-abrasive denture paste like Polident. Do not use toothpaste. They're too abrasive for the denture, and can cause microscopic scratches. Now, when you're soaking dentures and partials, you'll use a cleanser solution or tablets such as Efferdent, and this reduces and kills bacteria. Fixodent, Polygrip, and C-Bond are all 3 types of adhesives. They come in powder, cream, or wafers. It's important, depending on which product you use, again, that you follow the manufacturer's instructions. But it's also important to note that these products are only used for a little bit extra security. By no means are they recommended as a permanent solution to ill-fitting dentures. So as you can see, the use of dental aids can significantly ease access to oral care, which in turn will improve oral health for our residents. Dental health and daily oral care, to include recommended dental aids and products, are crucial for our residents' overall health and quality of life.
We hope you found today's webinar informative and helpful in your effort to provide effective daily oral care to your residents. From the entire Senior Dental Care team, we want to thank you for all that you do.